main concern was my size, and seeing my pictures on definitely, on the 3D imaging definitely was put my mind at ease, and it was very helpful. I was definitely able to see what my final results and were going to be, and also help my husband, who was my other deciding factor on my surgery, and it was definitely helpful for him as well to help me make my decision. It was pretty much right on to what it was on screen. My pictures before, I was able to actually see how big I was going to be, and so it was really wonderful. I'm very happy with my results. I was a little bit hesitant on choosing the size that he wanted because I thought it was going to be too big in the end, but once I saw my pictures on the screen on the 3D imager, I was definitely able to see that it wasn't too large, and it definitely was the right size for me. And I'm so happy that I listened to him and I saw my pictures, because if I went smaller, I probably would have not been happy with my outcome. I would have definitely wanted to go larger. I was able to, with the doctor, just look at every angle. I was able to, make them bigger and smaller, and kind of really pinpoint exactly where I wanted to be. Doing the 3D imaging definitely will put your mind at ease about picking the size, because that is probably the most common question or concern of people, women who want to get their breasts enlarged, is that they don't want to be too big. I personally am a mother, I have 2 small children. I didn't want to be unhappy with my results. I didn't want it to be, the wrong size for me. For a patient, I think it's more for a visual. It's more for visually seeing exactly where it's going to be. A doctor can tell you how many cc's you want to be, but for the patient, just seeing is believing. It's just seeing it in front of your face to kind of say, okay, that's the size I want to be, and that looks good on me. And I think that's a good, proportions my body the right way.